Pleased to welcome Hannah Sibeth this morning and Dr. Michael Sharma. We're talking about strokes and surviving strokes this morning. How are you both? Good to have you here. Doctor, you're with the Ottawa Hospital Regional Stroke Program or Center, whatever you want to call it. And you guys have recently done a study, right?
Yes, so we were interested in preventing strokes because we can treat stroke, but the best strategy by far is to prevent them. What we were looking at was one of the leading causes of large, devastating strokes, and that's atrial fibrillation.
Atrial fibrillation?
Yes.
For the layman, what does that mean?
So your heart has 4 chambers, and they work in concert to get blood to the lungs and then out to the body. And one of these chambers, the left atrium, which really is the pace setter for the heart, usually when it functions, it gets the heart going and beating nicely and regularly like that. When the pace center isn't working, the muscle in that chamber just sits there and twitches. And we call that fibrillation. Blood pools, it forms blood clots, which then travel up to the brain, block a blood vessel. That part of the brain that was getting blood from that blood vessel dies. And that's a stroke. So because these blood clots are large, they cause large strokes.
Yeah, Hannah, you're with this program now, right? You're taking the medications and so on to deal with atrial fibrillation.
Yeah, they originally, when I first was diagnosed with it, they put me on Coumadin, which is warfarin, which essentially can be used as rat poison. And they're very low doses. But Coumadin has been around for probably about 50 years now, and it has certain problems, like you have to watch what you eat. You can't eat food with vitamin K in it, which are green leafy vegetables. You have to watch when you have if you're sick, it can throw what's known as your INRs, which you have to sort of keep between 2 and 3. I don't know what INR means.
International normalized.
Thank you. And you have to keep between 2 and 3. If it goes too low, your blood's too thick. If it goes too high, your blood's too thin, which results in a lot of bruising and all kinds of problems.
It's funny because a lot of people don't even understand that a stroke is directly related to the heart in the end, right? Especially in this case.
Yeah, so strokes are really events that occur in the brain, though they can start in the heart as they do here.
Right, and your husband has been through a stroke, right? So you know what this is all about.
Yeah, it's quite devastating. He had a very large stroke, and thankfully, I mean, he's improving very slowly, but he is improving. They thought he would never improve, which is amazing. So you really have to be aware. There are also newer drugs out now, a newer drug called Pradax, which is, and there are other pharmaceutical companies working on new drugs as well, which are easier to take.
Your husband's relatively young, and what is the age group we're talking about here when it comes to AF?
So AF and stroke are directly linked to age. So the older you get, the likelier you are to have it. For men, you know, you can have a stroke at any age. So babies have strokes. It can occur in utero, in fact, before birth. But for men, it's pretty flat until you hit the age of 55, and then it starts to take off in terms of incidence, and it doubles for each decade after that.
No kidding.
Yeah, but Hannah, for instance, is on the young side, especially for women with AF, and yet she has it. It's something that unless you know about or think about, you're not going to contact.
You wouldn't know.
No, and you want to get to it before you have a stroke.
What should people do then if in fact you know, they should be checked out, obviously, to see if they have atrial fibrillation?
So there are a number of things that can be a tip-off. Your pulse or your heart rate can be irregular, and you can sometimes feel that as palpitations. Your heart racing or beating irregularly. You can get short of breath, and in extreme cases, faint. I think, Hannah, you were symptomatic when you had it.
Yeah, I thought I was having a really huge asthma attack, and in fact, I was going into congestive heart failure. My heart rate was like 190, and it was irregular. And
all over the map.
Oh, and I felt horrible. I couldn't breathe. It was awful. But I have what's called lone atrial fibrillation, which is there's no reason for it.
Right. Well, we're going to run out of time, but I want to get the message across that you know what, strokes are preventable, and this is one of the ways to go about it. Where do we find more information?
There's a website that's been set up for this, Kurt. It's called strokeandaf.ca. So if folks go on that, they'll be able to check out the information and see what they should do.
And anyone in the age categories and so on should check it out.
Absolutely. If you're a man over the age of 50 or a woman over the age of 60, you absolutely should.
I qualify. Recently, I qualified.
barely qualify.
Yes, but it's good to get checked out. Thanks both for your time today.
Thank you.
Appreciate that. See all the great, we were talking about, all the good work we're doing in this community, that's for sure, with the Ottawa Hospital Regional Stroke Center and so on, and we met some people earlier with the University of Ottawa Heart Institute. A lot happening in this community, and a lot of people are skating, which is good exercise for you. They're skating on the canal, which opened yesterday. Hallelujah. More on that coming up as we head toward hour 3. We'll be right back.